Well, we're thankful that you chose to have surgery with us at New Life Cosmetic Surgery. Your upcoming surgery, we're really looking forward to, but there's some things that I want to quickly discuss with you to make sure that you're aware of what to expect. So here's the things. Number one, we really want you to review the consents that you're going to sign. It's very important that you go through those consents, read them, and if there's any questions that you have, that you ask us about them. One of the things that I would want with one of my family members having surgery is for the staff to be readily available to go over any type of questions that we have regarding the procedure and the consents of the surgery, and we are open and available for you. We want to go through those with you. We do go through those with you. And when you sign them, we want to make sure that all of your questions have been answered. The next thing going into surgery is super important is that you do not smoke before surgery. You need to not smoke for 4 weeks before the surgery. There's a lot of forms of smoking now. The main thing is nicotine. So when I say a lot of forms of smoking, there's cigarettes, there's tobacco, there's jewels and vapes and all those things. If there's nicotine in it, you can't use it for 4 weeks before the surgery, and we will test you before the surgery to make sure that there's no nicotine in your system. We take that very seriously because if you were to have nicotine in your system, it could decrease the blood flow to the incision, and your incisions can basically, and the skin can die. So for 4 weeks before and for 4 to 6 weeks after, we do not want you to ingest any type of nicotine. The next thing is going into the surgery, we want you to feel comfortable. We want you to make sure that, like I said, that all your questions have been answered and that you're not going in with any doubts. So please do not come on the day of the surgery. Yes, you're gonna be a little bit nervous, but we don't want you coming the day of the surgery with a lot of questions. So if you have those questions, please ask us those questions before the day of the surgery. We'll be happy to answer any of those things for you. So what you need to get before the surgery is a few things. One, you need to load up on a lot of fluids. I want you to be drinking at least as much as, at least a half a gallon to a gallon of fluids for 5 days before the surgery, so you're super hydrated. And you want to continue that process of hydration after the surgery. Number two, I want you to load up on protein. Go and get protein shakes, protein bars, any source of protein that you can get, because I want you to eat after the surgery 100 grams of protein, or drink 100 grams of protein a day. The next thing I want you to do is make sure the garments or any of the compression devices that we talk about, that you have them before the surgery, because we will give you the recommendations for them, but sometimes after the surgery, when you're trying to get them, or you're trying to wait for them in the mail and it's taking a little bit longer, it's best if you can get those before the surgery. The next thing along with the incision healing is I love collagen peptides. So please be taking your collagen peptides. You can get it over the counter. It comes just in a big container, and put a scoop of collagen peptides. And I've seen just plenty of patients see a difference with them taking collagen peptides. The last thing is do not take aspirin or other homeopathic or natural vitamins that can thin down your blood for 2 weeks before the surgery. It's just can lead to more blood loss, and so we go over those with you. But if for some reason you develop some pain or joint aches or something like that right prior to your surgery, please avoid any type of aspirin or ibuprofen or Aleve or Excedrin right before the surgery. If you need something, take Tylenol. But those are just the main things. So we look forward for you having surgery with us. We're going to expect to have great outcomes. And if there's any questions that you have regarding your upcoming surgery, please let us know. Thank you.